huge amount of variability. A huge amount of variability throughout his day, and particularly those fasting levels. So this is at 12 a.m. and in the morning, and we're seeing this huge amount of variation. Although his fasting levels, the averages, were showing within what's considered the normal range. So his average glucose overall was 6.1 millimoles, glucose variability at around 17%, and the time in that optimal fasting range between 4 and 6 millimoles per litre was only not even 60%. But this was giving him a HbA1c of 5.9%. So with this information, after a month, we were able to target some specific dietary advice and create some significant changes for this guy. So this was only 1 month later when he used another CGM, and he was able to really bring down these fasting levels and tighten up his glucose variability like really significantly. So his average glucose came down to 5.2, glucose variability, so that range, and we can see that from the graph straight away, down to 12%. But the big one is this time in target, so 91% compared to under 60%, and a normalized HbA1c as well, so no longer pre-diabetic. So the changes that we really focused on for this user was we lowered his fasting glucose levels by focusing on dinner. So we reduced the spikes that he was having at nighttime with higher protein, higher fiber dinners, and really focused on vegetable intake with dinner. We also looked at his sleep patterns. He was struggling a lot with sleep, and looked at a more structured sleep hygiene routine for him, and ensured that he was having consistent meal times, because previously it was a bit ad hoc when he was able to do it. So Michelle, I'll pass back to you to explore the role of CGM in preventative health.
Okay, so CGM for preventative health. So for those that are really just fresh, CGM just stands for continuous glucose monitoring. And this technology has been around for probably about 10 years and been in the clinical setting for probably about 5. It is on the public benefit scheme for people with type 1 diabetes, so for those that are using insulin, and really is a game changer and takes away that need for the finger prick blood testing that we previously required. Now, we do suggest that you always, if you're using insulin, which we don't, Vively has not been designed for that process, but to always check and make sure that the CGM is correct by using a blood finger prick test as well. So it really gives a broad brush stroke. So the CGM machine is about a 20-cent size of a 20-cent piece. And the little filament that stays within the arm measures the interstitial cellular glucose levels. And there's an algorithm that matches it to what the blood glucose levels would be. And so what we know about the use of CGM in diabetic populations have found to be incredibly beneficial. So a study from 2020 found that 90%, and these were in the diabetic population, felt that CGM data supported better lifestyle choices. Now, as practitioners, we know that changing someone's lifestyle is often a very difficult thing. There's a lot of information in the community that is misrepresented, that is dominated by influencers on social media, and sometimes it's difficult to get through the noise. 47% felt it made them more likely to exercise if they had high glucose levels. And often what you can see when you're using a CGM, Charlotte and I have used many to explore it ourselves, is that when you do have a meal that is spiking a blood glucose level, to go for a 20-minute walk within 20 minutes of that meal rapidly brings down the glucose levels. And it's quite satisfying to actually watch that happen. And 87% felt it assisted in healthier food choices. They are significant statistics in terms of a behavioural change intervention. But everyone, someone's not on mute. Would that? Okay, great. Thank you. There was another study in 2018 that found a significant number of non-diabetic individuals had abnormal glucose regulation, with up to 15% of the time spent in the pre-diabetic ranges. Now, we've found that even up to 30% of our data, if not more, are actually spending time in the pre-diabetic range. So it's very good for early diagnosis. Going back to that original slide, a lot of metabolic syndrome, a lot of dysregulation in glucose is actually being missed. So it's a profoundly good tool for making suggestions that might have major behavioural interventions long term. We're potentially missing a significant number of people living with glucose dysregulation, and CGM data is a game changer in educating individuals, particularly about the intersection of other factors. So glucose dysregulation is not just about food, it's also about exercise, muscle tone and muscle strength. It's about sleep, and it's about the role that stress plays within the environment as well. And so having an ability to look at a key homeostatic marker in somebody and look at those personalized lifestyle-related insights is next level in terms of a behavior change opportunity for practitioners to use with their patients. So the data, so I've used this in my clinic for a long period of time, as has Charlotte, that it really allows for a very tactile, very immediate representation of a person that is undeniable for that person. So when you have a good relationship and a good rapport with the client or the patient, you can really start to personalize those nutrition and lifestyle advice. So more research is needed. It's very much a new technology in terms of the use in non-diabetic population, but it really is a space that with burgeoning and growing evidence base month on month. Proper interpretation of the data is a critical factor for successful long-term behaviour change and clinical decision-making. And working with clients in this real-time world really can transform the way that you practice and utilize and really enhance metabolic health, which we know has implications for mental health, physical health, and prevention of long-term chronic disease.
Thank you, Michelle. I'm going to jump in with another case study. So I feel really fortunate having been able to work in Vively within the in-app, but also in clinic. And Michelle, you've been doing this as well for a little while now. And so I thought I'd just give you a little bit of a background of this person. So it was a 62-year-old female who came to me for weight loss support. She found that energy levels and fatigue were really starting to impact her day, like her work life, her daily life. And she was just starting to feel really defeated. So she'd gone to her doctor and was told that she was pre-diabetic and told to cut calories to lose weight. And unfortunately, she'd tried that multiple times over the years with no success. And the only real information she was able to actually give me in clinic was my 3-monthly blood test, or her HbA1c, was high. Her mother also has type 2 diabetes, and she saw that the implications and the outcomes that that can have when poorly managed. So she was really quite frightened of what her health state looked like. So we initially did some behaviour change strategies, but then thought that CGM would be really beneficial to give her some concrete information to work off. So when we did that, these were some of her graphs. So initially in August this year, she put a CGM on, and I tell you, in session, she was terrified when she saw the data and how much variability. So her average glucose levels and HbA1c were putting her in the diabetic range. So average glucose of 7.8 millimoles. Glucose variability, as you can see from these bands, was really quite high. But I think the biggest one for her, again, was that fasting levels, those levels overnight that she just didn't realize were happening on the daily basis. So after some consistent behaviour change, she was getting a little bit antsy after a couple of months, really wanted to know what the data was showing and whether it was working, all of these changes. So as you can see, in just a few months, she was really able to tighten her glucose variability. Her average glucose came down to 7.1, so still sitting in the higher range, but a significant difference compared to 7.8. And we're starting to see a tiny bit of space within the normal range. So starting to see 8% of the time within that optimal range, but amazingly, HbA1c has come down. We then continued to work together, and she's currently seeing me as well. And what we did next, we really focused in on some of these changes as well. So this was a month's difference from October to now. You can see those overnight levels have changed dramatically. So we focused quite heavily on dinner. Again, that was the trouble time for her, to really normalize some of these levels. So now average glucose levels of 6.2. Glucose variability has jumped up slightly from last time, but I mean, it's a lot more normal. But the time in target, 43% sitting within that normal range compared to next to nothing when we first started, and HbA1c of 6% as well. So with this client, what did we focus on? We really focused on fiber and protein with every single meal, and adjusting how her meals were consumed. So we started a meal with a side salad or a starter salad, and then her main protein and sometimes carbohydrate, depending on her activity levels. But we prioritized her carbohydrate earlier in the day. We really focused on tuning into her body. What does this feel like when my levels are high? The change in her energy levels is just incredible without having these fasting levels just sitting so high all the time. Obviously, we also focused on overall nutritional status, getting lots of whole foods, making sure that she wasn't missing out on some of those key nutrients as well. And she's cooking a lot more at home. Interestingly, she's got her husband on board as well. So they are he's also cooking this way, and more of a Mediterranean style diet. She has been quite focused on the numbers as well. So we've had to do a lot of training around her fear around the spikes in her glucose levels. So reducing that black and white thinking, seeing what's normal, what's not normal, and what thought processes are actually helpful for her as well. But what I find most interesting, most of the work happens outside of sessions. So I'm only with the patient a small amount of time. So this is what she initiated herself. So after dinner, her and her husband go for a walk, and they're loving it. That's their time together every night after dinner. She's also realized that work was a major stressor for her and was able to put in some more structure around her work hours. And she's done this so that she can exercise. When I first met her, she said she hated exercise and couldn't think of anything worse. And she now exercises nearly daily with the walk with her husband, as well as these additional workouts that she is loving. She's been experimenting with different foods now and isn't as scared to try different things and learn new ways, which has just been incredible. Like, seeing the numbers for me is really exciting. I am a numbers person, but just to see this in the change in the individual has been incredible. So let's have a look now at the Vively dashboard and how this sort of information can help you in your practice. So what we've developed is a free dashboard for all practitioners to be able to provide practitioner education like the session today, and we'll be doing more of these, as well as support. We've got an easy platform that you can prescribe CGMs to your patients and clients, and as well as see the data for yourself. So you can link up that with your patient, and you can see that data live too. You can then analyze the trends and data for the unique insights and find those points of focus for your client to really see the results. We can also automate the education and behaviour change for the patient with all of the practical, there's articles, challenges, and just the data that the people can see within the app as well. So what we're actually going to do is jump onto the dashboard, and I'll show you what it looks like. So if you haven't already been here, we'll be sending out how to do this afterwards as well in the email to follow up. But this is what the Vively health dashboard looks like. So as you can see, we've got our client dashboard here. We've got a help center with plenty of information that Michelle and I and the team have put together to help yourself understand metabolic health, as well as your clients and patients. And we also have the option to prescribe. So I'll walk you through that first. So we go to the prescribe option, and I'm just going to put in, I'm not typing very well today. Oh my goodness. Charlotte Test, well, that won't come up.
You spelled Charlotte wrong too.
I know. Yep, I'm doing a great job. So if the patient doesn't have a Vively account, you can pop in their email address. You can also write some special instructions, but because this email doesn't have the option, or isn't already a user, sorry, we can actually choose how many sensors you want to prescribe for that person. They don't have to purchase every single one that you prescribe, but they've got the option to. So you can actually choose whether it's 1 sensor, 2, 3, or up to 4 sensors. So this price also includes the 3-month app subscription fee, as well as the sensors that are included that you've chosen. So for this one, I'm just going to go 1, and special instructions, you could write whatever that might be for you. So I want you to use 2 consecutive sensors and then have a break, or whatever that looks like. And then we will take care of all of the logistics. We'll send them the sensor, we'll send them the setup for the app, and send them an email straight away that you've invited that person to do that. So that's something that we can do here. But let's jump in and have a look at the data. So we've got a test account set up for us. And this is the information that you're going to see. So as you can see, we've got how many weeks of the sensor. You can choose to compare different sensor periods. So we've got the dates. So you can choose, if we go to this sensor history, you can choose from any of these options, and it will change the data that's shown in those averages. So as you can see that we've been showing throughout the presentation, we've got your average glucose, the glucose variability, the time in target, and the estimated HbA1c, as well as that really nice glucose graph. We also collate all of the notable glucose events. So that's any major glucose spikes, how long that data stayed high as well. And you can click on these to see what that information is about. So that will take us to the daily chart. I missed one thing back here, so I'll just come back because we've got our average fasting glucose here, as well as the number of spikes. So again, we can compare that over time periods and see how that information changes over time as well. And lastly, we've just got this graph down the bottom with our time in target. So how much of the time spent in each of these bands down the bottom. But to get to more the granular detail, we can go to the daily chart. So this information, if we go to our click box up here for our calendar, we can choose a day. So any of the these highlighted days have glucose data, and we can really see what that looks like. So there's not a whole lot of information on this log. So let's go back to our glucose overview and find one that's got all of the information. Okay, so here's an example of a day. Now, there used to be these gaps in the data as well, but that was just because the sensor only held 8 hours worth of data. So if someone scanned further than 8 hours, there might be a few gaps in there, but that shouldn't be as much of a problem now that Freestyle has linked it up automatically. So you don't actually have to scan the sensor anymore. But what we can see here is that daily graph. It's got all of these food logs on the graph. So this one's a pretty stable kind of day. And down here, you can see their sleep logs. So they've got 7.4 hours of sleep and their times, as well as their meals. And you can actually go into the meals and see the 2-hour data for that particular meal as well. So this one was yogurt, berries, chia, and honey. It depends what the user's put in or your patient has put in as to how much information will be shown here. But you can see that glucose data, and you can do the same for sleep logs as well as exercise. So you can see what their glucose levels might do over that time period. There's no information for this particular one, but you can get more granular detail as well about their sleep efficiency, deep sleep, REM sleep, and core sleep. So lots of different information to be found in there. I mean, I could go on for an hour explaining every little detail, but I'm cautious of time as well. So I'll start to open it up to the Q&A. So if you want to pop your questions into the chat, and Michelle and I will answer those as best we can. So Michelle, I will ask you a quick question if that's all right. So we've got a question: can you calibrate the blood glucose? Wondering how reliable CGM data is compared to blood glucose levels, and what's the margin of error?
So the exact margin of error, I don't know, I can't answer that. But what we do know is it's sufficiently accurate, and the accuracy increases the longer that the person wears the CGM. So when we're talking about the average blood glucose, hemoglobin A1C, so long as the sensor has at least 10 days, that seems to increase the accuracy of the correlation to a blood hemoglobin A1C, for example. We do know that the first 24, even up to 48 hours of the sensor, there tends to be a lack of less accuracy, and there seems to be a kind of almost like a in-body calibration experience. Like Charlotte might be able to talk a little bit more into that. And also when the sensor comes towards the end of its life, that can occur as well. And so we're getting those kind of nuances, which is why having a practitioner involved in the interpretation of the data becomes so important. Because Vively is not designed for somebody that is an insulin dependent type 2 diabetic or an insulin dependent type 1 diabetic, it has been designed as a behavioral change intervention using real-time data. So it is sufficiently accurate to match blood readings over a period of time. So the Freestyle Libre is a TGA, what's the terminology, supported, approved medical device. So we're reliant upon that hardware to deliver those results.
I think one of the other factors that can often be misinterpreted as well is, so the CGM itself measures the interstitial blood glucose levels compared to blood glucose. So there can be a lag time. So it's something that comes up all the time is, I did a finger prick test and my levels were way off. So they say it's about 15 minutes of how much that can lag as well. And so if someone's doing a finger prick and their levels are spiking or crashing, that amount of difference will be much higher compared to if it's more stable. So that's just another thing to keep in mind. And Michelle, I think you often remind us as well that it's not as accurate reading those low levels.
Yes, that's right. So the low levels are less accurate. And so what they do recommend, if anyone's using insulin, for example, which we're not designed for, is that you would never, ever activate any intervention based on a low CGM level. What they do know is that the higher the reading, the more accurate the CGMs tends to be. And to Charlotte's point, those spikes and those crashes, often what you find when people have got better metabolic flexibility, which is a lovely kind of term which is starting to kind of be used in the literature, is that you want your metabolism to be flexible. So say, for example, in evolutionary biology, where people would, before fridges and supermarkets and ultra-processed foods, for example, when we ate from nature, we often did a lot more exercise, and we might come across, some fruits or some, foods that might spike our blood glucose level. But often our ancestors had high levels of metabolic flexibility that their body could tolerate those kind of things. And so when a blood sugar level spikes, it's not so much of a problem so long as the body has the resources in which to kind of bring it down. And what we know is that a strong musculature and really good muscle and overall visceral health, then a body can tolerate those particular glucose spikes. So to Charlotte's point, if your blood glucose level is either spiking or dropping really rapidly, what the CGM, if we're relying upon that and there's a 15-minute gap, we might be seeing something that is occurring in the past. And so to respond to that, we need to kind of wait and give time to fully understand the results.
We've got another question about how to use the sensors and where to put them on the body and why may you need more than one.
Yeah, so it's a great question, and we've been sort of looking into this as well through the thousands of people that have been using the sensors. So what we find is that what we don't want to have people is to rely just upon the sensors to dictate their personalization of their health. So we don't want to take away the trust of the body. Charlotte's example of JW, the second case study, was such a beautiful example of the way Vively can be used, in the sense of getting someone to become much more aware and even mindful of the impact or the effect of blood glucose levels in the way that they feel. Sometimes what you notice, and many of you would agree, is some people are really quite almost out of body. They're so almost detached from the role of their lifestyle in terms of their overall health. And the way that they feel is almost enmeshed in this kind of, how should I say this? Concoction of just so many different factors that are detracting from their optimal health and well-being, for example. And so they've lost that nuance experience of what their choices are doing to the way that they feel. And so when you use a sensor, what I found in my practice is that depending upon the level of, I guess, understanding and health literacy a person has, is that first 2 weeks can be quite confusing. And in fact, we kind of want it to be confusing for some people if they really don't have very much personalized information from themselves. And we don't necessarily, like, confusion is not bad so long as they feel like their hand is held and the interpretation of the data can really help for them to formulate new ways of understanding about their body. And so depending upon that health literacy and what people want to achieve, is that we like to kind of pulse sensors. So for example, you might wear it for 2 weeks, come back and see a practitioner and start to get some interpretation of the data and what has been input. So for example, one of my patients, she could see both her food choices, her emotional health, and her stress and her sleep were all impacted by this stressful job she was doing. And she could see it very clearly on her blood glucose levels. And then come the weekend, her blood glucose levels would go back to being completely normal. And so for her, it was like JW, the case study that we just had, she started to make some really interesting changes that were her personal choices. And that was quite an interesting, I didn't have to do anything to advise her. It was the combination of seeing that and having some accountability and some support for her to make some pretty significant changes in her life. And then what that person might like to do is then in another 2 weeks or 4 weeks time, put another sensor on. And then to see, like, if they've made some changes, the impact of those changes on a 2-week sensor period of using a CGM. And so depending upon a person's goals or their lifestyles or how much they're changing, also like Charlotte's first case study, he was struggling with his weight. He'd tried multiple different things. He'd found this new information really empowering. So he wanted to do a sensor every month to really track his situations. And then obviously when you're getting really good feedback, you start to get really thrilled about it. And you really want to have a look at the impacts as well. The other thing to recommend or to realize as well is when somebody is building up musculature or changing a very unhealthy metabolic function, is sometimes it can take quite a bit of time, particularly for those that are carrying a lot of weight, have a lot of insulin resistance and a lot of inflammation. And so if you're doing them too quickly and the person's lifestyle change is not as dramatic, we don't want them to lose, I guess, momentum from that if they haven't made any changes and they're not seeing the results on that glucose homeostasis. So that's the beauty of having a practitioner to understand the nuances of those sensors and what you feel that your patient or client might psychologically need from a motivation, behavioral intervention, and a metabolic reshaping impact. Does that make sense?
Yes, it does. And I'll just go back to where the actual sensor as well is placed on. It's placed on the back of the arm. So we've got lots of videos to help people set that up. Michelle puts one on herself within the app to talk people through it. So it sits on the back of the arm. It works for 14 days. So that's the life of the sensor, which is why we keep talking about that two-week period. And as Michelle said, it's totally up to you when and how often you use that. Within the Vively app, we actually recommend using one every 3 months so that you can see that longer term behaviour change impact as well, because we do understand that it gets quite expensive if you are sort of using them continuously. So it's, yeah, dependent on the patient and the user as well. So we've got another question. Do you know what the mechanism is that relates to blood sugar and muscle tone?
Yeah, so muscles, the health of muscles are dependent upon how metabolically active they are. So a muscle cell is a very metabolically active cell, and it requires a lot of energy in which to sustain health. So it tends to increase your metabolic rate when you have stronger muscles. When the muscles start to decline and start to become to atrophy, what happens is that fat tends to sit alongside the muscle, and that tends to make the muscle weaker and not as metabolically efficient. And so higher muscle tone actually relates to better blood sugar efficiency. We also store a lot of glucose in our muscles as well to activate that. So if you think about the fight-flight response, when we are stimulated and we need to move in a kind of quick fashion, the muscles have to prime themselves and become very metabolically active, and they use up a lot of the sugars, and they also release that into the blood to go to other parts of the body as well. So the muscles are a very important part of metabolic health, and they become a storage for blood glucose as well as a metabolic reserve.
What I found really interesting as well is the impact of that exercise. So using the muscles, really using them as a tool to help normalize those glucose levels. So that 20-minute walk, I think, Michelle, you were saying it in the evening, it seems to have the biggest impact for people's fasting levels as well. So using those muscles, building those muscles, but allowing them to be able to actually activate and use the available glucose as well, can be such a powerful tool for people to see as well, because we all know we should be exercising. we're all told 30 minutes of physical activity every day.
The other interesting thing is when you look at the way traditional cultures often do their traditional ways. Like, for example, the Italians will often walk after a meal. And so, I lived in Italy for a little while, and there's probably some Italians in our group, but they know that they get up after dinner and they go for a walk around the town. It's a very social time. It's a very beautiful time of the evening, and many cultures do something similar to that. And so looking at the way, strong cultures tend to work on their health it can be insightful. And that's one thing that I've noticed as well.
Fantastic. And I think one of my biggest take homes as well is we now have this opportunity to really personalize the care that we're giving. We're not just using all the knowledge and the information that we do have. Like, we are health professionals, we've got this information, but we're able to then transform it into something that's really meaningful for that person, for where they're at right now. That's what I've really liked. Like, there's been not one person that I've said the same advice to specifically, when we actually look at so much information there as well.
Yeah, and I think with that too, as practitioners, sometimes making sure that we've got that personalization for our own enjoyment as well can really enhance our ability to stay very interested and passionate in that, doctor-patient or, practitioner-patient relationship. So it really can improve the vitality of your practice from a personal perspective as well, not just about the results of your patients.
Yes. Definitely. So we've just had another question. Can you confirm that I'm understanding correctly? Once a client subscribes, it costs them $228. How many days does this outlay cover? Is it only the 14 days? So yes, that is correct. With the $228, that gives them 1 CGM and 3 months access to the Vively app, which, as I said, has all of the education and articles in there. You can track the sleep. So something I forgot to mention actually is this is the only platform where you can pull in all of the wearable data. So from an Apple Watch, Garmin, any of those sorts of devices that people are using, all pulls in as well, which makes it such a nice way to see everything together. So the additional that $228 sign up fee or subscription cost, that's actually within the app as you prescribe it. That's a discounted cost for your patients. Normally it's $249 for that quarter, and there is a benefit to practitioners for signing up as well. So we've got a question asking about the integration with Samsung and Android watches. I believe this is an option at the moment, but I will have to double check with our support team as well to make sure that that's the case. There's a reason I'm not on the tech side of things. Oh, and another great question within the wearable data, can we see the glucose relationships with menstrual cycle timing? That's a fantastic question, because that's another use case where you might actually want to do 1 month, so 2 sensors, because that can have a significant impact on the glucose regulation in that time. At the moment, we don't have that capability, but we are certainly working on it. We take on all of our practitioner feedback really seriously. So anytime you've got suggestions or things that you feel would really benefit your practice, please let us know, because we want to build something that you guys want to use and find really valuable to your clients as well. Did you want to add anything about the cycle tracking at all, Michelle?
Have I lost you?
No, we're still here.
Lost the chat. I just something. Well, it's good that you still got me. No, we've been working on that for a little while. What I'll often suggest to my patients is to track their cycle using, another app as well. And we've been looking at bringing in a menstrual cycle app. In the I see a lot of people with perimenopause, and it's a great thing to do with perimenopause, particularly because there is so many fluctuations, and it can help someone if we think that they've got a metabolic issue or they put on a lot of weight through that perimenopausal period, to actually track their blood glucose levels as well. So can be a fantastic addition for that. Also in my practice too, I see a lot of PMDD, which is a good thing to do too, to try and get balance back into the a key homeostatic marker. What we know is blood glucose, blood insulin, blood cortisol are all very much interrelated and have a huge impact on sex hormone regulation as well. So the use of CGM and the use of metabolic health and really focusing on that can have a very significant impact on PMT, period regulation, even fertility for some people, if that is an underlying factor for them.
Fantastic. Thank you for that explanation. I think it's something that we're starting to learn so much more about, and it comes up a lot with the clients that I'm working with. Also, one of the things that, while we don't have a tracker at the moment, there is the option to actually leave notes, so people can log symptoms, they can log when they've taken medication, for example. So that can be really interesting if there's particular things you want your patients or clients to be actually monitoring. You can start to ask them, just make sure, like, you log your migraines or log when you're starting your period. So then you've got that information to go off as well. So it's all, again, will show up on that daily graph.
Yeah.
But I've just realised the time. That is all we've got time for this evening. So we will continue this chat. So we've set up a new Vively Health Partner Facebook group. So if you search for us in Facebook, that's where we'll continue this conversation. And anytime you have questions, you can pop them in there. Michelle and I are there to help out. And we've recorded this session as well, and we'll pass that on to anyone as well. The email to follow up will also give you a bit more information about how to become involved as a Vively Health Partner also. But thank you so much, everyone, for joining us. Thank you, Michelle, for your information as well.
Thanks, everyone, for coming.
And we'll see you next time.
See you.
Bye.